We will be tackling or discussing pulmonary tuberculosis in children or pediatric clients. But first on hand, let's compare it on how we do it with diagnosis with adults. So in short, in adults, we are expecting for any of these signs and symptoms as long as the patient is having these signs and symptoms for um, more than or equal to 2 weeks, either cough, unexplained fever, unexplained weight loss, and night sweats. So again, for pulmonary tuberculosis, for diagnosis, we need this either of these symptoms for more than 2 weeks for adults, cough, unexplained fever, unexplained weight loss, or night sweat for us to know or to screen patients with Mycobacterium tuberculosis infection. So with that, we will be using the algorithm using this, in which chest x-ray will be utilized, then the sputum sampling will be done, and the expert MTB ref test, which is now the choice or the procedure of choice for us to screen for patients with MTB. So again, for children, for pedia, for pediatrics, all we need to do in here is to have at least one of the following signs and symptoms for 2 weeks. We have unexplained cough or wheezing. So in adults, no, we don't have that wheezing, but only the cough. Unexplained. Example, not responding to antibiotic or bronchodilators. Remember, antibiotic, the antibiotic of choice for pneumonia, for example, we have your amoxicillin and your SABA for bronchodilator, or your short-acting beta-adrenergic, example, salbutamol inhalation. We have also here unexplained fever after ruling out other causes such as malaria or pneumonia. And we have also here unexplained weight loss or failure to thrive and no response to nutrition therapy. So basically here in our signs and symptoms, we don't have night sweats. In adults, we have night sweats. In children, we don't have that. So additional for children, among pediatric TB contacts, or if children are exposed to diagnosed TB, either clinical or bacteriologically diagnosed. So even if without above signs and symptoms, presence of more than or equal to 2 weeks of fatigue, decreased activity and playfulness, and poor appetite is already considered as presumptive of TB. So these are the additional things that we have for pedia in comparison to adults tuberculosis detection. So if with available chest x-ray it is suggestive of TB, that is also a qualification. And if we have at least one of those signs and symptoms of tuberculosis, then we need to collect samples of the sputum, or pwede extrapulmonary samples, no? Especially for children more than or equal to 8 years old. If sample is available, then do expert MTB or ref test. Before, the diagnostic exam of choice was sputum microscopy, but now it is now the gene expert or the expert Mycobacterium tuberculosis test, or the RIF test or rifampicin test for resistance against Mycobacterium tuberculosis, because rifampicin and your is the determinant the basis for the resistance, no? Then if sample is not available, then do chest x-ray. If the chest x-ray is suggestive of TB, then we follow the diagnostic algorithm for TB for treatment that includes regimen 1, regimen 2, regimen 3, regimen 4, and regimen 5. So if positive also for gene expert, then do the same algorithm. So that would be all for our treatment for tuberculosis.